Hello, everyone. Welcome back to Open Line. We have with us Dr. Bruce Randolph. He's the health officer of the Shelby County Department of Health. He's joining us via Zoom, as all our guests are nowadays with the coronavirus. We're talking about why are African Americans at greater risk of contracting COVID-19 and dying, having it be fatal. We talked for a bit there off the top. I'm going to go to calls now. I'm going to go to Lucy first here. Hello, Lucy.
Hey, Mr. Hall.
Hi. Go right ahead.
I can't hear you when I'm on hold, but anyway, I've got several questions for your guest. And the first question, Dr. Randolph, is what is the population of Shelby County? I've got about 5 or 6 questions. What is the population of Shelby County?
Shelby County population is near.
Can you hear me?
Can you hear me?
Can you hear him? Yeah, he's talking right now.
I can't hear him at all.
All right, I'll repeat what he says. So the population, what is the population of Shelby County?
Population of Shelby County is right at 1 million people.
It's right at 1 million people.
Right at 1 million people, okay. And he said that 54% of the population of Shelby County is black. And my question is this is what I'm trying to figure out with this coming up with these samples. The testing to me is just absolutely crazy. If you tried to pull off what our federal government is trying to pull off 40 years ago, they would have sent some people packing to another country. This is the most ridiculous thing that I've seen, the way they've done this testing. The samples are very minute. Dr. Hillebrand, I watched him this morning on the mayor's briefing here in Nashville, and he talked about what low percentage that we've actually tested, and those testing positive. And he's correct, on his numbers. It's really like a drop in the bucket. We need the test. We need the data. So what I'm curious about, of that 54% of the black population in Shelby County, how much of that population have you tested? And I'll wait for Mr. Hall to tell me what you're going to say, because I got other questions.
So do you know what percentage? Yeah, go ahead.
Yeah. I would certainly admit that we
Yes.
That we have grossly untested. I mean, we have not tested enough people. We've only tested 15,000 people. So, yes, that is a small sample. And we've done, and of that 15,000 people that we tested, 1,432 of those turned out to be positive. So right at about 9.5% positivity rate.
All right, so Lucy, this will be your last question because I'm going to stop. But he says they've only tested 15,000 people. Obviously, they haven't tested enough. Of the 15,000 they've tested, 9.5% are positive. So what is your final question? I think you're onto something good here, but your final question.
15,000 are black.
Okay. How much of that 15,000 would you say are African American?
Of the 15,000 that's been tested, I don't have that information, but I can tell you of the analysis that was performed of those that tested positive. 911 of those 1,432, we were able to determine the demographics on. There's 521 that there's missing information. Race, demographics wasn't on the encounter form when they submitted it for the testing. So of these samples of the results that we had information on as it relates to race, it was 911 of those. Of that 911, 648, 71.1% of those were African Americans. 217 which is 23.8%, were white. Now, one of the things is that when we look at the geographic distribution of the testing, it has been, there's a disparity there. A lot of the areas where blacks live have not even been tested. So the disparity could be even worse because we don't know. There's a disparity even in the sites. So one of the things that we've recently committed to is expanding the various testing sites so that we can get people who are more vulnerable tested.
So what you're saying is alarming in a sense. I mean, you're saying that there are sections of the community that haven't been properly tested. I mean, testing has certainly been a frustration all across the country, really. But you're saying
Yes.
there are large sections that have not been tested. We don't have a real idea of what's happening there. When you read these numbers of the number of positive and the number of cases, you don't think the testing, we don't have enough data to really confidently say what's going on.
Exactly. So give you an example. There's a few sites that's set up for drive-through. Well, if you don't have a car, how are you going to drive through? So if you're relying on public transportation, then you're not able to even take advantage of the drive-through testing. Or in some situations, in order to be tested, you have to be referred by a physician, or you have to go online and register. Well, if you don't have a computer, if you don't have a personal primary care provider or physician to refer, how are you going to be tested? We're now making arrangements whereby we take the testing to the people rather than wait for the people to come be tested. And also, we're making it where you don't have to have a referral from a physician or order from a physician in order to be tested, because we do need to test more people to get a better sample and a better reflection of this distribution of this particular disease.
I believe Governor Lee said today that there are going to be more tests, that if you want to test, you can get it. How soon before you feel like those areas in Shelby County that haven't been appropriately tested will be appropriately tested? How soon will we be where we need to be with testing?
Well, we have 2 new sites coming on this week. And the effort to do some mobile pop-ups will also start this weekend. So hopefully, beginning next week, we'll start having additional numbers to see what the overall picture looks like.
All right, I'm going to go. There are a million questions there with testing. We'll come back to that topic. I'm going to go to another call here. I'm going to go to Leon. Hello, Leon. Leon, are you there? Leon, come back if you want. Let's go to Jamal. Hello, Jamal, are you there?
Hi, how you doing this evening, Ben?
Doing fine. Go ahead.
I was just want to comment on the fact that it's not really issue about attacking the African American community more. It's just the nature of a capitalistic system. I mean, without the economic backing of healthcare in the neighborhood, and I mean, you got a lot of people who just don't have healthcare, and then with families living, 2 generations, 3 generations in a household, you don't have the space to quarantine. And so it's more of an economic thing in a capitalistic system more than it is the fact that it's attacking the African American community more than just a white community. I mean, it's like grocery stores in an African American neighborhood. You can count how many fresh Krogers or Publix are in that neighborhood. They call them food deserts. And I mean, if you can't get good food, how can you have good health? And so it's the American way. It's been going on for 40, 50 years. And I mean, how do you change it without everybody under this umbrella bonding together and trying to say, hey, you know, we are all Americans and we need to get everybody on board to helping everybody else out, because the virus doesn't see color.
Right.
It sees a human to attack, and we're all humans. That's all I have to say, Ben.
All right. Thank you, Jamal. And that kind of echoes what you were saying, right, Dr. Randolph?
Absolutely. I mean, the thing is that unfortunately, a lot of times things get colored with race, when in fact it's economics and culture. And the fact that, you know, this disparity that we see is not so much because black people are black. It's because of the economic and social disparities. And it'd be interesting if, you know, it's been shown that, you know, there's a disparity in the health status of wealthy people, whether they're white or black, versus poor. And it'd be interesting to even look at what the numbers will look like even in, say, Davidson counties and other areas where you don't have so much of a black population, but if you compare wealthier whites to poor whites, is there a disparity?
And likely the answer will be yes.
Yes.
All right, we will. Okay, let's take a break. Leon is back on the line. Leon, I promise we'll go to your call next. If you want to call in, there's the number 615-737-PLUS, 615-737-7587. We will take a break. Be back right after this.